Ever pondered about the intricacies of the human mind and the impact of antipsychotics on mental health? It's an area rife with complexity and nuance, much like the organ it revolves around. Mental health, a vital part of our overall well-being, is often affected by various disorders. These disorders may warp our perception, alter our emotions, and disrupt our thought processes, creating a ripple effect on our lives. To manage such conditions, we turn to a class of drugs known as antipsychotics. These medicines over the years have been divided into different generations, each with its unique properties and effects. But today, we're turning our spotlight on the pioneers, the first generation of antipsychotics. These drugs, despite their age, continue to play a pivotal role in managing mental disorders, holding their ground amidst newer, more modern alternatives. So what makes the first generation antipsychotics so unique? Well, let's delve into their history and find out. The journey of the first generation antipsychotics is an intriguing tale of scientific discovery. It all began in the 1950s, an era marked by significant strides in the field of medicine. One such stride was the groundbreaking discovery of clozapine, the trailblazer of first-generation antipsychotics. This was a time when the understanding of mental health was still in its infancy, and the discovery of clozapine brought a ray of hope in a dark tunnel. Clozapine, initially developed for surgical anesthesia, was found to have a calming effect on patients. Its potential to treat psychiatric disorders was soon recognized, forever altering the landscape of psychiatry. Patients with symptoms of psychosis found relief in this little pill, and the world of psychiatry celebrated this revolutionary treatment. Following the success of clozapine, other first-generation antipsychotics were developed. Drugs such as haloperidol, fluphenazine, and thioridazine joined the ranks. These medications, much like their predecessor, worked by blocking dopamine receptors in the brain, thereby reducing the symptoms of psychotic disorders. They became widely used for managing conditions like schizophrenia, bipolar disorder, and other forms of psychosis. The development and widespread use of these first-generation antipsychotics marked a significant shift in the treatment of mental health disorders. For the first time, there was a tangible solution to a problem that had long perplexed the medical community. Thus, the advent of these drugs marked a significant turning point in the treatment of mental health disorders. Now that we've understood their history, let's unravel the key points about these first-generation antipsychotics. The mechanism of action of these drugs is quite fascinating. They primarily work by blocking dopamine receptors in the brain. Dopamine is a neurotransmitter, a chemical messenger that transmits signals in the brain and other vital areas. When there's an overactivity of dopamine, it can lead to symptoms of psychosis. So by blocking these receptors, antipsychotics help to reduce psychotic symptoms such as hallucinations, delusions, and disordered thinking. These drugs are often indicated for a range of conditions. They've been a game changer in the treatment of schizophrenia, a mental disorder characterized by abnormal behavior, strange speech, and a decreased ability to understand reality. They're also used to manage bipolar disorder, a mental condition marked by extreme mood swings that include emotional highs and lows. However, like all medications, first-generation antipsychotics come with their share of adverse effects. These may include extrapyramidal symptoms, which are drug-induced movement disorders that can range from restlessness, muscle stiffness, to tremors. Another significant side effect is tardive dyskinesia, a condition involving involuntary movements, especially of the lower face. There are also certain situations where these drugs are contraindicated. For instance, in patients with Parkinson's disease, a disorder that leads to shaking, stiffness, and difficulty with walking, balance, and coordination. The reason being, Parkinson's disease is caused by a decrease in dopamine, and since these drugs work by reducing dopamine activity, they can potentially worsen the symptoms of Parkinson's. So despite their side effects, these drugs have played a crucial role in managing serious mental disorders. Understanding them helps us appreciate how far we've come in the realm of psychiatry. So we've journeyed through the history and key aspects of first-generation antipsychotics. These drugs, despite their adverse effects, have laid the foundation for treating mental health conditions and have transformed countless lives. Their role in psychiatry is as crucial as understanding their mechanism of action, indications, and contraindications. It's an exciting time to delve deeper into the advances of this field. Remember, the quest for knowledge is never ending. keep exploring, keep learning,